Morning sickness. It's a part of up to 90% of pregnancies. But when it comes really severe and you need hospitalization, that's when doctors say it's hyperemesis gravidarum.
It is severe nausea and vomiting that comes to the point where folks are losing weight. And typically in pregnancy, we like to see folks either maintain their weight or gain weight. So that's usually one of the main differentiating factors, and that's usually where we have the interventions that come into play from an inpatient standpoint.
That's Dr. Jamel Bingham. He's an OB/GYN at Hartford Hospital. He says this condition isn't really that common. According to the Cleveland Clinic, it affects about 3% of pregnant people. But there are factors that will put you more at risk. If you have multiple pregnancies, like twins or triplets, if you're pregnant for the first time, have a family history of it, or of motion sickness and migraines, and you're at risk if you've had it in a previous pregnancy.
15% or so of folks who've had it one time can have it again in subsequent pregnancies. We know that taking folic acid supplementation and taking your prenatal vitamins within usually a month before becoming pregnant helps to reduce the risk of it occurring again.
And prenatal vitamins with folic acid aren't just helpful for people with this severe morning sickness condition. Dr. Bingham says it can help in other ways during pregnancy as well.
We know that folic acid not only has benefits from the nausea and vomiting component, but it also has benefits for reducing the risk for miscarriage in the first trimester. So for many folks, proactively having a multivitamin as part of their health maintenance is very helpful.
Now, other items that help with everyday morning sickness, according to Dr. Bingham, are ginger, acupuncture, bands of people often use on cruises when they have seasickness, and vitamin B6. In some cases, treating morning sickness with these remedies can keep it becoming from more severe. Dr. Bingham says more transparency will also bring more awareness and help mothers realize there is a whole host of ways to treat this, and it doesn't always have to involve medication.
Because I think that's one of the things that makes it challenging for folks in their first trimester, particularly first-time mother. They don't want to do anything that could harm the pregnancy. But at the same time, we don't want you to be suffering, because pregnancy is supposed to be a wonderful time in your life.
And treating the illness is important because it can impact far more than just someone's health. Dr. Bingham says it can cause difficulty in things like sleeping, exacerbate depression and anxiety, even financial stress, because it's hard to work with this, and it can also increase your relationship stress too.